Today we will discuss about pyloric stenosis, which is also called as pylorostenosis. It is more specifically labeled as infantile hypertrophic pyloric stenosis because it most often occurs in the first few months of life, commonly in the firstborn male child, which is aged about 3 weeks to 3 months. Pyloric stenosis is rare in babies older than 3 months of age. Pyloric stenosis is more common in babies born prematurely than in full term babies. So, signs of pyloric stenosis usually appear within 3 to 5 weeks after birth. First is vomiting after feeding, because the baby may vomit forcefully, ejecting breast milk or formula up to several feet away, that is why it is also called as projectile vomiting. This vomiting might be mild at first and gradually become more severe as the pylorus opening narrows. The vomit may sometimes contain blood. Also, one of the signs is persistent hunger. Babies who have pyloric stenosis often want to eat soon after vomiting. Next sign is stomach contractions. So, you may notice wave like contractions, that is peristalsis, that ripple across baby's upper abdomen soon after feeding but before vomiting. This is caused by stomach muscles trying to force food through the narrowed pylorus. Next sign is dehydration. Baby might cry without tears or become lethargic. You might find yourself changing fewer wet diapers or diapers that are not as wet as you expect. Child of those parents who affected with pyloric stenosis and their child may get pyloric stenosis. Most common cause for laparotomy before 1 year. Pyloric stenosis also occurs in adults where the cause is usually a narrowed pylorus due to scarring from chronic peptic ulceration. In adult, it can occur due to history of peptic ulcer in pylorus region and hypertrophic changes in muscle layer of pylorus. If we want to see the ratio of male as to female, it occurs as a 4:1 ratio. So, in which races pyloric stenosis is mostly found? So, it is most common in Caucasians of Northern European ancestry and less common in African Americans and rare in Asians. The pylorus meaning gate and stenosis meaning narrowing. So, pylorostenosis is a narrowing of the opening from stomach to the duodenum. Duodenum is the first part of the small intestine. And definition wise, pylorostenosis is the thickened pylorus is felt classically as an olive shaped mass in the middle upper part of right upper quadrant of infant's abdomen. So there is no specific cause of this, but there are like nitric oxide synthesis deficiency, nerve cell theory, or smoking during pregnancy, because it can nearly double the risk of pyloric stenosis. Also, early antibiotic use. Babies given certain antibiotics in the first weeks of life and this erythromycin to treat whooping cough, for example, have an increased risk of pyloric stenosis. In addition, babies born to mothers who took certain antibiotics in late pregnancy also may have an increased risk of pyloric stenosis. Some studies suggest that bottle feeding rather than breastfeeding can increase the risk of pyloric stenosis. Also, it is due to enlargement, that is hypertrophy of the muscle surrounding this opening, which spasms when the stomach empties. Pathophysiology wise, the gastric outlet obstruction due to the hypertrophic pylorus impairs emptying of gastric content into the duodenum. As a consequence, all ingested food and gastric secretions can only exit via vomiting, which can be a projectile in nature, and persistent vomiting results in loss of stomach acid, that is HCl, and the high aldosterone levels causes the kidneys to avidly retain sodium to correct the intracellular volume depletion and excrete increased amount of potassium into urine, resulting in low blood level of potassium. The body's compensatory response to the metabolic alkalosis is hypoventilation, resulting in an elevated arterial CO2. So, what do we observe in pyloric stenosis? The thickened pylorus is felt classically as an olive-shaped mass in the middle upper part or right upper quadrant of an infant's abdomen. Consequently, this condition causes severe projectile non-bilous vomiting.